Well, my name's Courtney Brown. I'm going to do Rickettsia rickettsii. What is Rickettsia rickettsii? Rickettsia rickettsii is a small rod-shaped bacteria that's obligated intracellular. It's aerobic and gram-negative. So when a hardened tick, a male hardened tick mates with a female tick, the eggs of the newly formed ticks are infected with Rickettsia rickettsii. So that means these new hardened ticks have Rickettsia rickettsii within them. So, Rickettsia rickettsii is in these hardened ticks, and they latch onto a human. So once it latches onto a human, the bacteria Rickettsia rickettsii goes into the human's blood vessels and infects the epithelial cells. Once the epithelial cells are infected via the shuttle factor, phagocytosis starts. But Rickettsia rickettsii doesn't get swallowed up by phagocytosis. It actually starts immediately growing in the cytoplasm or in the nucleus of this epithelial cell. So once it's grown and it's matured in the epithelial cells, a filamentous actin comet tail is attached to the neighboring cell. And then Rickettsia rickettsii travels to the next cell. And once that cell's infected, it travels to the next one. And this is how Rickettsia rickettsii spreads throughout the body. So once you've been infected, once you've been bitten by a tick, Rickettsia rickettsii doesn't immediately go into you. It takes a few hours because the salivary glands of the tick actually secrete Rickettsia rickettsii out into your bloodstream. So you've been infected, and your cells are infected, and you start recruiting extracellular fluid, especially blood plasma. And this causes a lack of oxygen to the organs and tissues, a lack of nutrients being able to get to the organs and tissues, and low blood pressure. So when someone's initially been bitten, you would think they would show signs and symptoms right away, but that's actually not the case. The case is that it takes up to 4 to 10 days for an individual to start having signs or symptoms of rickettsia. And once an individual does, it's critical that they go seek medical attention because it can further into something that's life-threatening. So when you go see a health professional, make sure you tell them you've been bitten by a tick. So signs and symptoms that will occur is fever, headache, rash, nausea, vomiting, stomach pain, and muscle pain, and lack of appetite. The three most common that occur simultaneously and all are interconnected is the rash, the fever, and headaches. So when an individual gets a rash, fever, and headache after being bitten by a tick, it's a great indication that they have Rickettsia rickettsii or Rickettsia rickettsii bacteria in them, which actually, when Rickettsia rickettsii is in you, it grows into something called Rocky Mountain spotted fever. So that's what the doctors will diagnose you with. So they're going to treat you for Rocky Mountain spotted fever, and they will go and give you medication. They'll give you an antibiotic, one of three: diclofenac, tetracycline, or chloramphenicol. Okay, these three are the most common. However, diclofenac is the one that they prescribe the most, but you're going to be given over the other two because of the side effects it does not have on the individual. Tetracycline is known to have a high affinity to bind to calcium, which can be dangerous in this situation, and especially for kids, because kids need calcium for their bones, and so do older people because of osteoporosis. But it also causes teeth staining, so which is a huge issue because, as you can see in the picture, that teeth staining can be kind of nasty and it's permanent. It won't come out. Chloramphenicol is known to have a higher fatality rate, especially with fatal plasmic anemia, which occurs in kids, and it can happen with pregnant women that their babies can die. And so they avoid these two, and they do diclofenac instead of all the other three. There's really no vaccination or other treatment other than these three antibiotics. So if an individual gets these antibiotics, a medical professional advises about 5 to 10 days for the infection to clear up. But this can all depend on when your fever breaks. So if your fever breaks after day 3, it might last a little longer than if your fever breaks on day 1 after taking the antibiotics. But not everyone's the same. So if you need additional care because the severity of your case, the doctors will get together and a multidisciplinary team, and they will deal with your symptoms or what else is being caused by it. Because Rocky Mountain spotted fever has also been known to cause multi-organ failure, neurological issues such as a seizure, coma, and individuals really have issues because they don't go to the doctor and they're like, oh, I'm fine. And then when they do, they realize they have this and they could have amputations of their fingers or limbs, or they can have neurological issues when going forth. And so that's why it's really important when going forward to make sure that you take care of yourselves, especially if you've been bitten by a hard tick. So there's some things that we can do to prevent tick bites, right? Because Rocky Mountain spotted fever that's caused by rickettsia comes from being bitten by a tick. You can't transmit it between humans. No, it only comes from being bitten by a tick. So some precautions you can take on your day-to-day life is knowing where ticks are most common. So in Texas, I would say ticks are more common than they are in Arizona because of the humidity and the trees and the grass. What time of year it is. So do you think ticks are more active during the winter? No, they're more in like June through September because it's hot and it's moist for them. When you come inside, looking at your clothes, being like, oh, do I have any ticks on them or any bugs on my clothes, and taking them off if you do. Wearing tight-fitted clothes when you go on hiking, because a lot of people will wear loose-fitting clothes and they don't realize that bugs and everything can get underneath. You can also use repellents, so like bug repellents and tick repellents when you go and you're outside and being active, either construction or hiking or just going out playing sports at the park, whatever it is. And you also probably should shower. So showering can get the ticks off and everything. So it's funny because our pets often bring ticks into our house often, and they'll get on to us. So take care of your pets also. Make sure that you bathe them with flea and tick shampoos if they have either of those. Use tick collars. Tick collars are an easy way to just prevent ticks, or even giving your dogs medications. So we know that rickettsia causes Rocky Mountain fever, or Rocky Mountain spotted fever. And we know that we can do things to prevent that from a tick biting us. Because when the tick bites us, that's when we're in trouble. So going forth, make sure that if you have been bitten by a tick, hardened tick, that you do make sure that you look after yourself and you're like, in the next few days, if you see any signs or symptoms, please go get medical attention. Don't sit there and think you're fine, because this can be a life-threatening disease, and it actually has caused people to die because they don't take care of themselves. So rickettsia is caused by ticks, not by humans, can't be transmitted, and there's many things you can do to prevent it, but there's only a few treatments that will actually cure it. So thank you again. Have a good day.